I'm 26 years old and I am missing genetic material from chromosome 7 that has altered some of my organs and physical features. This impacts my ability to have abstract thinking and understand spatial relations. I do not have normal communication skills or understand the need for emotional connections. I have Williams syndrome. We will be sharing a few phases of Williams syndrome from toddler to adulthood. Rachel will discuss how Williams syndrome is a genetic defect that has to do with chromosome 7 and its effect on specific genes.
What is Williams syndrome? Williams syndrome is a genetic development disorder with missing genetic material of the chromosome 7. This is caused during the development of the egg and sperm break in the DNA molecule. Even though this causes to have more than 25 missing genes of the chromosome 7, people with Williams syndrome can still have a full-time job, can be musically inclined, and still be very productive. Some of these missing genes that are caused by the chromosome 7 are the CLIP2, the LIMPK1, the GTF2I, which relates to the visual spatial tasks and unique behavior characteristics through everyday living, such as owning a driver's license or having a savings or checking account. Christy will go into more detail of that later in the presentation. A couple others are the ELN, which cause the cardiovascular disease and abnormalities of the connective tissue, and the GTF2I-RD1, which contributes to the specific facial features, such as a flattened nasal bridge, which Amber will discuss later in the presentation. It's amazing how each specific gene is related to such specific bodily aspects that make part of the Williams syndrome. With that, I will now let Amber interest you in more detail about the physical aspect of Williams syndrome.
Just by looking at someone who has Williams syndrome, you probably wouldn't think anything was wrong with them. However, most children with Williams syndrome are known to have common facial features. Some of these facial features include having a small chin, a wide mouth, puffy eyes, full lips, and a small upturned nose. Another common facial feature attributed with Williams syndrome is small, spaced out teeth. Here is a picture of a youth girl with Williams syndrome. Also, babies who have Williams syndrome experience problems with feeding due to low muscle tone, colic, and having low birth weight. Even though there are prominent facial features caused by this disease that can be seen, there are also congenital defects that cannot be seen. Some of the major congenital defects that they have include problems with the kidney, groin, and umbilical hernias, hypercalcium, which is an elevation in the blood calcium levels, where in some cases medical treatment is needed. Children with Williams syndrome can also have sensitive hearing. This condition usually gets better as they get older. Williams syndrome children also have low muscle tone and joint laxity. As they get older, physical therapy can be helpful with this. Also, with Williams syndrome, they have some kind of blood vessel or heart condition. The average lifespan for someone who has Williams syndrome is about 50 years old. Christy will share the unique complications of language and communication, as well as the hidden difficulties relating to spatial relations and abstract thinking for someone with Williams syndrome.
Usually we all learn to communicate by mimicking our parents and those around us. There's no difference for someone with Williams syndrome. But the very unique way that language is learned, even the words themselves as Williams syndrome children develop, is primarily by repetition or rote. Almost every single word and conversation is rehearsed over and over until it seems to work into real conversations. A Williams syndrome person has a fantastic vocabulary due to a photographic memory for words. Spelling is usually accurate, yet not learned phonetically. The relational conceptual ability is very low because there is a disconnect with pragmatic aspect of language. If you were to have a 15-minute conversation with someone with Williams syndrome, that person would be great at giving very quick, short answers to your questions, yet not likely will they be able to carry a conversation on very long. The question may even be misinterpreted, so the answer may not make much sense. This leads into the next topics of the two very well-hidden disabilities of Williams syndrome. They are spatial relations disorder and abstract thinking deficit. Making language work for Williams syndrome people is tied into these disabilities, along with many other aspects of life. Here are some examples. If I wanted to cross the street, I wouldn't know when it was safe. If a car is coming, I can't tell whether it's going too fast, too slow, or whether it's too far away or too close. So the best thing for me would be to wait till I see no car at all. So in crossing a street, it can be very dangerous. They just don't have that assurity that it's safe. I'm 26 years old and I don't know right from left. If somebody tells me to turn right at this corner, I may not know which way to turn, and I feel stupid. Mostly I wear sports bras and I wear jeans that snap instead of button. The complication of having my hand and brain and eyes work together at hooking and snapping and buttoning things is a little bit too much for me. I have difficulty with flossing my teeth and braiding my hair. I just don't do those things. They're impossible. This all has to do with spatial relation. It is a hand-eye brain coordination that is like a very confusing puzzle for me to work out. It's literally impossible, and I will never be able to drive or cook. I live in a planned, scheduled, and predictable setting. If I haven't done something many times, I may not know how to react when something unplanned happens. If I was a driver and a deer jumped out or a person jumped out in front of me, I would forget that I'm the one that actually is in charge of the accelerator, and I would not know to put the brakes on. Or if I was cooking and something started to burn again, I wouldn't realize that I'm the one in charge of turning off the stove and making sure that it's not burning. I was given a few dimes and I wasn't even sure whether I could buy earrings or a car. You see, I have no abstract thinking ability. Money means nothing to me. It makes no sense and has no value. I can't even remember if a week is longer than a month or a month is longer than a year. These are like art and they are abstract in my mind. You see, I can be a danger to myself as well as to others if my environment isn't well planned and full of rehearsal and routine. To some, I may appear lazy. If I'm given more than one instruction at a time, I only hear or process one. I'm not ignoring what I was asked to do. I just didn't have the ability to process two things at once, and I don't even realize that there were more than one instruction. My mind stopped at the one I heard, and I carried it out as best I could because I love to please people. These disabilities cannot be seen by others, but I may be judged for my lack of understanding what is common sense to most people. I'm Kaylee, and I am 26 years old. And now Rachel will conclude our discussion on Williams syndrome.
In conclusion, we have shared how the missing genetic material of chromosome 7 makes living with Williams syndrome complicated in respect to communication, understanding abstract concepts, as well as causing physical disabilities and lack of emotional connections. The photos have been a touch of reality to emphasize the beauty of each individual and the joy on their faces.